And lots of stories about bariatric surgery and how it can improve your health on numerous levels. And I am joined by two gentlemen who have been with us before. I'm talking with Dr. Sheff and Dr. Jeremy Joyner. They are both fellowship-trained bariatric surgeons with Phoebe Sumter Hospital in America. Sumter, good to see both of you, and thanks for being here again.
Thank you.
The main thing, we want to make sure that if people are considering this type of surgery and they just want more information, there's an event tomorrow night here in Albany. The Phoebe Bariatrics will have a free weight surgery seminar at 6:30 p.m. It'll take place at the Phoebe Northwest Conference Center. Normally, how many people attend?
Well, it just depends from meeting to meeting. We've ranged anywhere from a few people to upwards of 30 before.
Okay.
So it's about an hour long.
And are you holding these meetings still, is it monthly?
We have a meeting every month, but we're going between Americus and Albany. So every other month we'll be here in Albany, and then so that'll be this month, and then next month we'll be back in Americus.
And you need people to register or pre-register for the seminar?
You don't have to. It helps just to help us get a head count and know if the meeting's gonna be large or not. But you can just come too if you want.
All right, and let's refresh everybody's memories when we talk about being a fellowship-trained bariatric surgeon. What's the difference with that? What does that mean?
Well, it means that in addition to surgical training, which means that after you become a doctor, you do 5 years of general surgery training, both me and Dr. Joyner did an extra year focusing on bariatric surgery or laparoscopic bariatric surgery, which means doing these kind of weight loss surgeries using small incisions and cameras.
All right, and do we have images? I believe we've got some images. You perform the types of surgeries, the laparoscopic?
We've got two types of surgeries. One is the laparoscopic band, which you see on the screen there. And this is a device that's implanted around the top of the stomach to limit the amount that you can eat at one time. So it makes you feel full. You don't eat as much. The other one is called a laparoscopic sleeve gastrectomy, which is where you actually remove most of the stomach, probably about 80 to 90% of the stomach. And again, it limits the amount of food that you can eat before you feel full. Both of these limit the amount of calories that you take in a day, and that eventually leads to weight loss.
All right, let's talk about the average weight loss with these surgeries.
Well, it really depends on what your starting weight is. People that are heavier tend to lose more weight pound-wise. So the way we think of it is percentage of their excess body weight, meaning if you're 100 pounds overweight, how much of that body weight are you going to lose? So generally what we aim for in our program is to get 60 to 80% of that excess body weight. So like I said, in the example of someone who's 100 pounds overweight, they'd be talking about somewhere of 60 to 80 pounds. Okay.
And then a big question, I'm sure for a lot of people, are these surgeries covered by insurance?
They are. It just depends on the insurance coverage, and that's one of the things that we like to go over with each individual.
Okay.
Once they've been to the seminar, we can get all that information from them, and we've got a bariatric coordinator that is great at working out the coverage and what it will cost. We also offer cash only service. And it's an incredible discount if that's what you choose to do, if it's not covered by your insurance company.
Well, take us over, if you can, a little bit, what you cover in your seminar.
Well, first off, we talk about the reasons why people need weight loss surgery, what the benefits are, why that excess weight causes early death. We like to go over the procedures themselves, how much weight you can think of losing in each one. We like to talk about what the particular complications are that can happen from surgery. Every surgery has risks. This is not a magic pill. This is something that has real data behind it, but also has real risk with it.
All right, we need to take a break, but when we come back, let's talk about the health benefits of having this procedure. Stay with us. We will talk about more about bariatric surgery after the break. Stay with us.
Don't miss the Mystery Moonlight Madness celebration at Payne's Auto Mart in Moultrie, Friday, June 27th from 5 to midnight. Door prizes, mystery cash giveaway, live entertainment, and free watermelons and cantaloupes. Now's the time to buy. Get to Payne's Auto Mart in Moultrie.
Can you tell us what happened in your accident?
I was slowing down for a stoplight, and some guy just smashed right into me.
Bam! He just came out of nowhere.
I just called, and Ken made it easy for me.
Ken works fast.
Did you get a good result?
My case was worth $250,000.
My case was worth $400,000.
Now, I can't guarantee what your case is worth, but if you've been hurt in a car wreck, call me. One call, that's all.
If you've been hurt, Ken wins. Call 1-800-CALL-KEN. 1-800-CALL-KEN.
Are you one of the millions of Americans suffering from chronic knee pain, arthritis, or osteoarthritis of the knee? Have you been told you might need knee replacement surgery? Then call the number on your screen and see if you qualify for a breakthrough treatment that is helping thousands find relief from knee pain without pills and without surgery. This new treatment uses a natural lubricant that the healthy joints in your body produce every day. This all-natural lubricant is introduced into the knee joint where it coats and protects the cartilage surface, helping it to move smoothly once again. This emerging treatment is approved by Medicare and many other primary and supplemental health plans and is considered by many to be the first major breakthrough for relieving knee pain in years. So if you're tired of living with knee pain, call the number on your screen right now and learn more about this emerging knee pain treatment. It might be the knee pain treatment that changes your life and gets you back on your feet.
Don't miss the Mystery Moonlight Madness celebration at Payne's Auto Mart in Moultrie, Friday, June 27th from 5 to midnight. Door prizes, mystery cash giveaway, live entertainment, and free watermelons and cantaloupes. Now's the time to buy. Get to Payne's Auto Mart in Moultrie.
WALB News 10 and HD, sponsored by Mottlick & Associates. Call 1-800-LAW-NEED.
Welcome back, everybody. I'm still talking with Dr. Sheff and Dr. Jeremy Joyner about bariatric surgery. And during the commercial break, I guess just a blanket question, and I've been seeing a lot of it on TV, you know, in the morning and in the evenings, talking about the health benefits, especially for somebody who may be a diabetic. Speak to that, if you will.
Well, there's innumerable health benefits from losing weight as far as reducing mortality, which is when you die. Generally, people that are in our program look at a life expectancy of about 55 years. After bariatric surgery, you can look at moving that up to the normal lifespan, which is 76, or even higher based on, you know, your own genetics and health history. Diabetes is a very big factor in our culture. The rates are going skyrocketing as our obesity rates are going up. Part of that problem is genetics, part of it is weight. There's no doubt that weight causes increased peripheral insulin resistance, and so by losing weight, patients are seeing their insulin resistance go down, meaning that they need less diabetic medications, their blood sugars are going down. In fact, in many cases, many of our bariatric patients get off all their medications and are essentially cured of diabetes.
But this is not, as you say, a magic pill. It's really a part of a lifestyle change that you're expecting.
Right. We like to consider this really just a tool that you can use in an overall healthier lifestyle. Like I was saying before, the surgeries, both the surgeries that we offer really work by limiting the amount of food that you eat before you feel full. Most of us...
And again, if I can interrupt, we've got before and after pictures that we'll put up there. Go ahead.
This is one of our first patients. She's a nurse at our hospital, and she's done incredible with the surgery. Her primary concerns were being healthier and being able to be more active to keep up with her family. And as you can see, she's accomplished that, and we just like to see her in the hallway, you know, just because she's beaming all the time. She's so happy with how...
What about recovery time?
Well, the surgeries are a little different than that. For the laparoscopic band, we usually say a week off of work. For the laparoscopic sleeve, we say 2 weeks out of work. But it's a very learning process. Those first few months, learning how to eat with the new restrictions on you, it does take a lot of, it takes a lot of desire to keep going.
Discipline.
And discipline, yeah.
All right, give us details about tomorrow night again.
So we'll be at the Phoebe Northwest Complex. And it's at 6:30 tomorrow night. Again, it's a free conference. It usually lasts about an hour. We'll both be there, and we'll be available for any questions that come up.
And I do have a phone number. You don't have to, but you would like to have at least a head count if you can get one, right?
Sure.
229-931-1152. You can also go to Phoebe Putney Hospital. Just type in bariatric, and when you get to phoebeputney.com, type in bariatric, and your pictures come up. Right? All right.
You can register from the website.
Okay, very good. 931-1152. Thank you both. Good to see you again.
Thank you.
And stay with us, of course, for our evening news when we will have an update on that fatal crash in Ben Hill County. You can always keep up to date with us on WALB.com, also on Facebook and Twitter.